In the last 3 years, about 2014, we went on to these rural areas in the Bako region of Mali, which is between the Bani River and the Niger River. And there's about 600,000 people that live in that area that have very limited access to any kind of primary health care.
We are into the realities of what basic communities that these people live in on a regular basis, and that's the ruralness, the poverty.
Before, they were suffering too much because it's too far to get water. But now, life has become easy for them.
We established this strategic approach to community development where we put in a well, and then we'll put in a health center, and then that health center will have solar energy, renewable energy. Nothing will shut you down quicker in Africa than lack of clean water, lack of electricity. Water towers are anywhere from 3,000 to 5,000 liter towers, and their primary purpose is to serve the health center. The health center then focuses on women and children, maternity and pediatrics. Why are we putting in a maternity ward and a dispensary? Is because that's the primary need that we're trying to address. In this area, before that, they would have to go 30 kilometers, 40 kilometers to be able to reach any kind of facility that would be halfway decent, or they'll just give birth in their house, which is usually a mud hut, or by a river.
Just this one water point will solve so many diseases that you will not even imagine. So many deaths that have been prevented that you have seen. So many children who would have been ill.
You don't know the reality of this community.
Yeah.
You can appreciate the value of this well and this water.
Yeah.
This water is more than gold. It's more than.
So these health centers are set up to become sustainable and to be run by local or Malian staff. On average, in the country of Mali, 5 out of 100 women will die during the birthing process. They die primarily because of a failure to be able to do a C-section. We have, over the last couple of years, actually put in these health centers, and now we've reduced, at least in those areas, in that Bako region, now it's 1 out of 100. Now it'd be great if it was 0 out of 100, but sometimes the ladies arrive there too late for us to be able to address those issues. The centers are set up so they're manned and staffed primarily by Malians. We have one North American pediatrician that rotates around all of these centers just primarily to do education. But as far as the daily work, the examinations, the distribution of medicine, the basic operations procedures are all handled by a staff of 4 to 6 people. Now, the other thing that's interesting about these centers is that they become financially sustainable. So once we get the facility up and running, we get the equipment in there, then the staff is able to come in, then we're able to bring in medication, and the staff sells the medication and people will pay for that medication, and therefore that helps sustain the staff, allows the staff to stay there. The village also is expected to build a home for the nursing staff that come into the village. So they assume all the responsibility, all the cost to building a home for the staff that's there, and the staff actually like to work in these centers because it gets them out of the city. They're able to make a living by practicing their medicine in these rural areas. They're able to have their own garden, raise their own livestock, and really have a little bit better life than they would in Bamako or these larger cities. One clinic, for example, that last year we looked at the finances and they had over $100,000 US in revenue or receipts, and they had $10,000 in reserve in the bank. And if you know anything about the Sahel or Sub-Saharan Africa, it is absolutely amazing to go out there and to think, where did people get $100,000 or these individuals get? So there's obviously a volume of people that are coming through that clinic, but also these the farmers and the people that are bringing money, their families are collecting money because they see the value of this healthcare for them and they're willing to pay for it. And so we've created 9 of these. We're going to the country of Togo, replicating the same kind of a model. And it's truly a franchise model in the sense that you set up your staff, you have some standard operation procedures within each of these health centers, you have nurse practitioners, You have your build out is all the same, your water towers are all the same, the solar energy. So we've been able to see this sustainability happen in our project in Mali, West Africa, and that's why we're now invited to Togo to replicate this same model. It's fascinating to be a part of that, it's fascinating to see the impact, but also to know that it is sustainable, that we're not going to continue to pour endless amounts of resources into the country without an idea of where it's going and what's its impact.